Whenever you come across a case of facial palsy, first step is that you diagnose that your patient is having facial palsy or weakness of the face. The second important step is that you have to localize the lesion, that whether it is a type of upper motor neuron of type of facial palsy or lower motor neuron type of facial palsy, because the treatment and investigation as well as management plan of both is quite different. So, as you know that the half of the face is supplied by one facial nerve and other half of face is supplied by other facial nerve. If the level, if lesion is at the level of nucleus or below, then there will be the complete paralysis of one side of face. All the branches of facial nerve will be equally affected. While in case of upper motor type of facial nerve palsy, as you know very well, that upper half of face is supplied by both side of the brains. So if there is a lesion on the one side, like stroke, cortical stroke of one side, so lower part will be affected, but as upper part of the face is supplied from the both side, so that will be spared. So how to look this important feature? For that you have to see the two characteristic clinical sign in your patient. First is that ask the patient to look towards the ceiling and look for the wrinkles on the forehead. If the child or patient, your patient is having wrinkles, it means that the upper half of the face is spared. Second is the Bell's phenomena. You ask your patient to close his eyes. If the child has difficulty in closing his eyes and his eyeballs turns upward, which we call as Bell's phenomena, that means that the upper part of the face is also affected. So let's see these findings in our child. So this child is asked to frown and look towards the ceiling. You see that on the right side the child has wrinkles, but wrinkles are absent on the left side. So it means that left side upper half of the face is affected, it is not spared. Second is you ask the child to close his eyes. So on closing, there will be the Bell's phenomena. So again, child has wrinkling on the right side, but the wrinkles are absent on the left side. So left upper side of the face is affected. Child has able to form the wrinkles on the right side. Second, this child is again having unable to close the left eye. So the failure of closure of left eye again favors that child is having the lower motor type of left-sided facial palsy. So both these feature, that child is unable to make wrinkle on the left forehead, as well as child is unable to close the left eye, and the Bell's phenomena in the left eye favors that the child is having lower motor neuron type of left-sided facial palsy. Definitely in that case, the lesion will be from the nucleus and towards the facial nerve root. So while in case of upper motor type of facial nerve palsy, definitely we see for the look for the lesion above the nucleus. Thank you.